Hi, this is Lauren, Science Campaign Director at the Ecology Center. I'm subbing for Mara this evening. She has fallen under the weather. We're just waiting for another minute or two for others to log on. For those of you that have just logged on, welcome, and thank you for joining us today for the Health Leaders Fellowship webinar. We'll get started in just a few moments. Hi, and welcome for those of you that just came on. We're going to give it another minute. We have some more people logging on, and then we'll get started. Hello, and thank you for joining us to today's Health Leader Fellowship webinar. We'll get started in just a few moments. Welcome, and thank you for joining us for today's webinar. I'm Lauren Olson, a Science Campaign Director, and I'll be your moderator for the evening. So first, as you'll see on the agenda on your screen, we have welcome and introductions. Then we have a presentation tonight just by Catherine Harrison, then question and answer, and then your evaluation. Currently, all attendees are in listen-only mode. If at any time during the webinar you have a question, please use the chat box to share it. After our presentation from Catherine Harrison, we'll have time for questions. Our learning objectives tonight are identify ways in which climate change negatively affects health outcomes and identify particular problems associated with climate change and health in Michigan and in the Midwest region. I'm very excited to introduce our presenters for tonight. We are fortunate to have Catherine Harrison back again this year. Catherine Harrison is the program manager of the Climate Change Champions program at the Center for Climate Change and Health, where she oversees physician training and curriculum development on topics of climate change, health, and health equity. She has previous experience in the health provider education and training, including directing continuing medical education programs. She has formal education and training in health, including climate change and health equity topics, through her BSN in nursing and her MPH. And now I'm going to turn it over to Catherine Harrison.
Hi, everyone. Thank you so much, Lauren. It's good to be with you all again this year. And I also am bringing apologies from my director, Dr. Linda Rudolph. She was struck ill today quite suddenly and regrets that she's not able to join us all. We really enjoyed doing this session last year, and she in general does not take cancellation of learning opportunities like this lightly. So I do apologize on behalf of her, and also, again, just excited to be with you again this year. If we have any returning fellows, just want to begin by acknowledging, let's see if I can get my screen, there we go. Acknowledging the Kaiser Permanente Foundation as well as the Kresge Foundation for their generous support of this program, our Champions program, and some of the resources I'll be sharing with you this evening. So just to start out, I want to point to a primary resource of our program and one that we rely heavily on to deliver some of the information that you're going to hear this evening, and that's our Physician's Guide to Climate Change, Health, and it is not released yet, still needs to go through kind of production and design, but you can see the topics that are covered in the guide. The Physician's Guide is available, and I have the website there for you all. And then you see topics that are new to the second edition. We did different profiles on specific communities of color across the US. We have some topical sheets on migration, conflict and violence, and a focus on intergenerational and also global equity in the second edition of the guide. So I know you've had already some conversations about kind of climate change basics, climate change 101. So we won't spend a lot of time on this, but just as a bit of a refresher and grounding, just want to kind of cover a few things. Primarily, you know, climate change is an accepted phenomenon for all intents and purposes. 97% of climate scientists do agree that it's happening. It is human caused and driven primarily, and that there is something we can do about it. So that's kind of just want to lay that out there, as we all know, and that if, you know, if we were had to describe it in one sentence on the spot, it's the result of heat being trapped in the Earth's atmosphere by greenhouse gases like those you see listed here. And those act as a blanket to keep energy in the form of heat within the atmosphere. And then we always want to distinguish when we're having these conversations about climate versus weather. So weather being what we observe in terms of temperature, humidity, precipitation, cloudiness at any given time and in a specific location. Climate being more of the average weather over a long period of time in a region, 30 to 50 years. And climate change being a systematic change in that long-term state of the atmosphere over multiple decades or longer. And when we think about where these emissions come from, they really are emanating from every facet of our modern industrialized lifestyles, from the transportation modes that we use, primarily cars, which burn fossil fuels. Our energy systems, while shifting, are still primarily fossil fuel based, even in California, where we have a point of pride of no longer having coal-fired power plants. We do still import some coal energy, and we rely heavily on natural gas and oil in our state for our energy. Also, our agricultural and diet systems, so the consumption of meat, the use of pesticides and herbicides, which are very energy intensive, as well as the sort of concentration of our agricultural systems that then rely on lots of transportation, again, fossil fuel based, and with lots of greenhouse gases being emitted. Finally, the byproducts of our sort of industrialized processes and consumer lifestyles that end up in landfills, and food that ends up in landfills, as those decompose slowly or quickly, all release emissions that have climate impacts. And we see these impacts across the country. This is sort of an overview of the main impacts of climate change. And I like this graphic, but it is somewhat misleading, because these, you know, for the most part, these impacts are being felt in some way in every region. You know, with the exception of, you know, here in the Midwest, we don't have hurricanes, but for example, the Southeast and Florida are in a long-standing drought, and last year had their worst wildfire season in history. So even though we in California have had historic wildfire seasons the past year, and that gained a lot of attention, it's also worth noting that these impacts don't just stay in these neat and tidy regions, and that's what makes some of the health impacts of climate impacts so complex as well. So, you know, whether it be sea level rise along the coasts or rising temperatures, basically everywhere across the country, these are the main impacts that we're seeing with climate change, at least here in the US. So a lot of the information we have today is either national or has some California examples where we weren't able to find Michigan data, or just not as applicable to Michigan. But we did just want to make you aware of a couple of resources: the Michigan Climate and Health Profile Report, as well as the strategic plan for 2016 to 2021 are great resources that I highly recommend you scope out in terms of some of the data I'll be presenting, as well as some of the actions and plans for the state. And in the next 5 years, there are some short-term and then long-term priorities for the state that have been identified. Priority threats in the short term for Michigan include extreme heat events, impacts on air quality, and also water impacts from extreme storms, and both quality and quantity for water impacts. In the long term, the state is more concerned about infectious disease, including spread and rising incidence of existing vectors, and then also, as in many places, food security and supply and safety are long-term concerns. So we're going to kind of go through these to start, and then I'll mention some impacts that aren't necessarily priority threats for Michigan, but that we at least want to be aware of. So starting with heat is often the most obvious, both extreme heat and rising average temperatures. This makes sense. It's usually the first thing folks think of when they think about climate change. impacts on heat or on health, and for good reason. It's the leading cause of weather-related deaths, but it can also cause complications for chronic diseases, including heart disease, respiratory illnesses, and renal disease. So in terms of heart disease, risks for myocardial infarction, arrhythmias, all increase with extreme heat. Asthma attacks, exacerbations rise with extreme heat, in part because of the rise in ground level ozone. As you see in the graph there, as temperature rises, it increases ground level ozone, which exacerbates asthma and other respiratory illnesses. And then also renal disease, both existing in terms of dehydration, but also there is emergence of new heat-related renal disease that's been studied in the past couple of years. Researchers at the University of Colorado about 2 years ago came out with a study that looked at populations experiencing chronic kidney disease when they had no previous risk factors. And they mapped that rising incidence to and emergence to areas that are experiencing dramatic changes in temperature related to climate change. So these are largely rural farm worker communities with very difficult labor-intensive farming happening. So one of the main sites was among sugarcane workers in the Caribbean. And again, they're seeing this new emergence of renal disease without any other risk factors. It's being termed heat stress nephropathy, and is kind of the first sort of new illness emergence that we've seen with climate change in terms of things that had not previously existed in terms of risk factors. In addition to complications to illness, we need to think about our drug interactions and efficacy. So particularly insulin and storage of insulin and other medications, also some psychotropic medications, and those used to treat Parkinson's are impacted by heat, either in their efficacy or in the interactions they cause. And then the risk runs the other way as well. We know some medications can limit the body's ability to either regulate or sense heat changes in temperature. So the risk for heat illness from some medications rises. The last two sort of impacts there, I'll talk more about when I get to food security, but just to note that extreme heat plays a big role in livestock and crop loss, something we've experienced quite a bit of in California, which then impact food prices and availability, and then allergies and air quality, which we'll cover next. And then also just to note on the side, urban heat islands, when we discuss equity, we'll talk about this a little bit more, but that these are considered kind of dense urban areas, few trees, lots of gray infrastructure like asphalt and concrete, lots of energy usage, and temperatures, particularly nighttime temperatures, can be quite a bit higher in those areas. And it's important to note that this can also be present in rural areas, not just urban heat islands. So in terms of projections for Michigan, a couple of maps here show what the outlook looks like. For Michigan, the max temperature for extreme heat is defined as being above 95 degrees, and there's an expectation of the number of days increasing by 5 to 25 days by 2070. And by the end of the century, Michigan's winters are going to appear more like those of southern Ohio right now, and summers will look a lot more like those of central Missouri currently. So that is kind of what is to be expected across the state in the coming decades. So closely related, and another really ubiquitous climate impact that has a big impact on health is air quality. So we mentioned that as temperatures rise, they drive ground level ozone and smog, which can exacerbate respiratory illness. We also see air quality impacts from drought as conditions become more dry and dusty, and even infectious disease spores that I'll talk about are carried more easily and can increase infections like valley fever. We also see more particle pollution from wildfires, from smoke, so PM 2.5 being the one we're most concerned about in terms of impacts on cardiovascular disease and respiratory disease. And then also with storms and flooding, we are concerned about exposure to indoor air, indoor mold, and even without major extreme storms, just higher than average precipitation over long periods of time in areas that are not, used to it and sort of equipped for that. So the impacts on health are both direct negative impacts, but also placing limits on health promoting behaviors, such as opportunities to engage in physical activity, or just to be outside and engage, in parks and getting out, and mental health and those sorts of things. So these are all things that we need to be concerned about. And again, a single sort of sentinel exposure linked to other climate change impacts. Closely related, as I mentioned earlier, are allergens. So as temperatures and precipitation vary and for the most part rise in many areas, we're having longer and stronger pollen seasons. This is related both to a decrease in the number of frost-free days across the region, particularly in the Midwest. You can see an increase from, as much as almost 30 days in the central area of the US and Canada as a result of rising temperatures. But also rising levels of CO2 act as kind of this superfood for plants, leading to both higher pollen production as well as more potent pollen spores. So, so both of those are increasing the risk for allergies among many populations. And then again, with the higher ozone levels, that works to sensitize the respiratory tract and make folks more susceptible and sensitive to allergies. And looking at Michigan, from a period of about a decade, 2001 to 2012, hospitalizations related to allergy linked diseases, which usually are from asthma and asthma exacerbations, rose by 71% in that period. And that is, we'll talk about observations from surveys with physicians about climate impacts that they're seeing, and this is one of the more common ones. So particularly last year with Harvey and Irma, and in the past with Superstorm Sandy and Hurricane Katrina, definitely storms and floods, extreme weather is another sort of poster child impact that comes to mind for folks when they think about climate change, and understanding both that there are shifts in the weather patterns and how storms behave, but that also as the atmosphere warms, it holds more vapor and is able to kind of unleash in large amounts these heavier rainfall. So we have both hurricanes, but also just large storms that are increasing. And in terms of health impacts, we of course know these are incredibly dangerous. Risks for injury and death from storms are high, especially among vulnerable populations, but also short and long-term negative mental health effects from either, the trauma of the event itself or longer-term impacts like economic loss and displacement. We've been working with Macomb County, I hope I'm pronouncing that correctly, in Michigan. They've recently conducted a survey, 2-year follow-up with folks who had been displaced from some severe storms and flooding 2 years ago in the state. And so that's kind of a local application of you seeing that play out in your state. And then as specifically mentioned in the Michigan Strategic Plan, there is a lot of concern over the risk for waterborne illness. So as in many places across the country, sewer systems are combined. So when those become overloaded with stormwater, the flows combine and run into channels being treated by wastewater facilities. So Then as those overflow, they often flood into streets and yards and parks, rivers and lakes, and that increases the risk of exposure. So some of the projections for Michigan that are under consideration, the sort of the benchmark of thinking of the number of days with greater than 1 inch of precipitation will increase by about 10% in the south, which doesn't seem like a lot, but all the way up to 40% in the north by mid-century, so in another 30 years or so. And again, that might not seem like a lot, but in April 2013, there were approximately almost 200 million gallons of untreated sewage released into the Detroit and Rouge rivers related to increased rates of precipitation. And in June of that year, Detroit released about 2 billion gallons of partially treated sewage and 82 million gallons of diluted sewage into the Detroit River. So again, as these systems become overwhelmed and municipalities and jurisdictions look to try to relieve pressure, oftentimes that means releasing wastewater into rivers and lakes and streams. And I know from being in Minnesota the importance of rivers and lakes for recreation, and I know that that's considered one of the best walleye fishing areas in the country. But I just can't imagine, after knowing that 2 billion gallons of sewage are being released, that I would, be inclined to boat or fish or swim in that area. And in that same year, there was also a lot of runoff that made its way to Lake Erie. And that year, Lake Erie had one of its worst algal blooms ever because of excessive runoff. So thinking about the impacts on our water systems is really important. Some other things to think about with extreme weather and precipitation is that when it's linked with terrible storms, we experience power outages, which have impacts for people using medical equipment or refrigerating medications, et cetera. It can also have impacts on carbon monoxide, gas leaks, et cetera. And so there was a storm actually it was a winter storm in December of 2013, where almost 500,000 homes in Michigan were without power, and almost 100 emergency department visits related to carbon monoxide poisoning were reported. Okay, so closely linked, thinking about infectious disease, we again mentioned flooding and storm surge. So things like Vibrio and other diarrheal disease pathogens, waterborne and foodborne illness are all linked to that. And again, earlier I had mentioned drought. So valley fever is something we've been dealing with a lot. We have had epidemics of valley fever in parts of California related to our longstanding drought. And we have seen, though, that the valley fever is linked to spores that are kicked up in the dust when it becomes very dry and dusty in these areas. And then when they're followed by periods of rain, which we've also had in California, those spores are sort of activated and cause the rising incidence in the disease. So the other thing, though, that is often not thought of is West Nile virus. We definitely think of rise in mosquito-borne illness related to higher levels of precipitation combined with temperature, but in fact, drought also increases the risk. So in Michigan, the West Nile virus first showed up in about 2002, and in 2012, there was a spike related to the heat and drought that coincided. And that year there were about 200 cases and 17 deaths. And this can be related to a couple of factors. For one, when water sources are scarce, mosquitoes and hosts will move toward more domestic water sources like pools, fountains, rain barrels, those sorts of things, and then that can increase the likelihood of contact with humans. But they also, the rising temperatures combined with drought will also have an effect on the vector itself. So it increases the rate of replication for the virus, as well as the number of feeds the mosquito will partake in, and also allows the population to grow by speeding the mosquito developmental rate. So a couple of different ways that drought impacts and leads to the spread of mosquito-borne illness. But again, temperature and precipitation rises are a big factor. They play a huge role, as these maps show, in the spread of tick habitats, and we'll talk a little bit about Zika if we have a chance, related to just how that disease, while not caused by climate change, has been able to spread because of the favorability of conditions for that mosquito to thrive in. So in the Midwest and in Michigan, Lyme disease is also a big concern. It is found statewide. The tick is found statewide. And in 2013, which is the last time we could find some numbers, there were about 165 cases, and that's expected to keep rising. So it first showed up in the early 90s, 1992, and then as recently as 2013 had 165 cases. So last on kind of the priority list, as discussed in the Michigan Strategic Plan, is food security and nutrition. And this is a huge risk area, both nationally, but also globally, and highly related to things like jurisdictional stability and migration and national security issues. So it is one of the areas that is mentioned often at the top of people's priority lists. And it's a very complex interaction between our agricultural systems and climate change, both in terms of causes and impacts, because in many of the processes and ways that we produce our food are driving climate change. And then the risk just turns right around from the impacts of climate change. So when we think about the contribution of greenhouse gases to the food system, or of the food system to climate change, it accounts for about 1/3 of all US greenhouse gas emissions when you take into consideration fertilizer use, refrigeration, transportation, land use changes, etc. And then food waste is a huge source, again, of methane especially, and we waste about 40% of the food in the US, and that's a huge contributor. At the same time, we have pretty staggering rates of food insecurity for an industrialized country. We've got almost 50 million people who live in food insecure homes. So that's the population of all the states I've lived in, which are California, Colorado, and Minnesota combined. And that includes almost 8 million children. In Michigan, the rates are just a little bit better than the national peak. They're about 14.7% of households, but that's still more than the pre-recession levels of 11% for the state. So, and the reason that climate change is having, or the ways in which climate change is having an impact, as I mentioned earlier, crop and livestock yields are reduced by extreme heat and drought, extreme weather events. In California, in the drought, we had hundreds of thousands of acres of farmland that were just fallowed due to lack of water. Livestock herds were culled related to the lack of water, but also the heat. We also see a reduction in chill hours. So in the north in California, a lot of our fruit groves, I'm not totally familiar, but I think we discussed last year in the webinar the impact on Michigan's cherry crops on harvest. I know in Minnesota, we've also had impacts to our maple syrup harvests. So warmer temperatures impact those, especially the nighttime chill hours that are required for production of a lot of those foods. And then again, ozone is just harmful all around, can reduce the nutritional impact or nutritional content of many of our staple crops. So soybeans, wheat, oat, green beans, pepper, and cause disease among those plants. And then finally, our fish yields, which are already at risk because of overfishing and kind of dead zones in the ocean. They are further impacted by rising acidification of the ocean, as the ocean acts as a carbon sink and captures a lot of that carbon dioxide. I believe it was 3 years ago now in California, we basically did not have a crabbing season in Northern California, which definitely impacted obviously the food supply, but also the livelihoods of many of those fishing families. And so lastly, then all of this kind of leads to both rises in food prices and water shortage, but also as pests kind of proliferate in this new climate, it might lead to increased herbicide and pesticide use, which we already have very high levels of use and concerning exposures, not only in consumers, but especially among our farm worker communities and their families. So we kind of address mental health as a separate section in our resources to really make it stand out, but it's something, of course, that we think of as being related to every climate impact. Again, we've talked about displacement and trauma and PTSD, which we see, definitely on the rise with extreme weather events, but also for those who are already experiencing mental illness and how, whether through medication effects from heat or disruptions in their social and economic lives, or more dramatic events like extreme weather, management of those diseases can be disrupted. We also see that mental health is being impacted by just the inability to engage in behaviors that help keep us mentally well, like physical activity, having good nutrition, getting enough rest, especially during extreme heat events, that sort of thing. And then finally, economic stress and anxiety. There's been some research out of Australia looking at how climate change is sort of impacting on a long-term basis the anxiety levels of a lot of children as they become aware of how the climate is changing, how their environment is changing, and what that's going to mean for their future. And then in just thinking about who is most at risk, pregnant women and children who are in developmentally vulnerable places. Although being pregnant at the moment, I like to think of it as a period of resiliency, and often it is, but there are changes that happen in different developmental periods that place us at risk. Those with pre-existing mental illness, of course, and then first responders, especially during extreme events and witnessing over and over a lot of the trauma, and more frequently are at higher risk. So I just want to run through quickly a few pieces, and some of this has been covered in other areas, but that we're not in the priority list for in the Michigan plans and resources, but are ones that we, again, have been dealing with in California quite a bit. So we've been in a long-standing drought, as many folks know, but water quality and quantity, of course, being impacted. In one particular area that we talk about a lot is Tulare County, California. This is a rural agricultural community in the San Joaquin Valley. And in November of 2015, which was still 2 years before the drought was officially declared over, or about a year and a half, they had over 6,000 residents in the county who had no water. Over 1,000 wells had run dry. Thousands of workers lost their jobs, agricultural workers, because of the fields that were followed, again, as I mentioned, due to lack of water. They did see a 25% increase in respiratory visits during this period. Again, a lot related to valley fever, but also just exacerbations of underlying respiratory illness like asthma, COPD related to the dry and dusty conditions. We also saw twice the statewide rate of diarrheal disease in 2013. So as water quantity and quality are impacted, we see changes in sanitation capacity or even just behaviors among folks. And then although they weren't severe impacts, one of our statewide surveys focused on mental health did show rising levels of stress, anxiety, and depression, especially among those who had were already experiencing those conditions during the drought period. And then, of course, this past year we had just the worst wildfire season in the state's history, both with Northern California, in, with wine country areas, as well as Southern California, down near Santa Barbara, followed by mudslides in that area. So this is also another big area of impact for California. And the impacts are of course local, but we also like to point out that they can have very far-reaching impacts, both in terms of air quality. So smoke plumes can travel thousands of miles and it affects the air quality. We in the Bay Area did have particulate matter that came up from Southern California during those fires. There have been particulate matter that's been able to be tracked from provinces in Canada all the way down the eastern seaboard of the US. So that can have impacts on air quality for people even if they're far away. Also water quality impacts. So in 2013, we had a fire called the Yosemite Rim Fire that was posed a threat to contaminate the water source that feeds into San Francisco several hundred miles away. So in terms of the residents being several hundred miles away from that fire. So these are not localized impacts that we think of just with wildfires. And then, of course, a lot of homes and businesses were destroyed, and in a state that already, and in many areas, facing a housing crisis that poses huge equity issues. We had a lot of emergency responders. We did have one death in the Southern California wildfires this year, but overall, there were 300 or so firefighters who were killed between 2000 and 2013 fighting wildland fires. So it is a huge risk for our first responders. And I believe I covered a lot of these other impacts in talking about just air pollution. Again, very, very closely linked to secondary health impacts. And then lastly, for California, of course, we think of sea level rise with many of our coastal communities. So again, the health impacts here can be very direct and dramatic, injury and death, but also a little more slowly evolving. So salinization of the drinking water, as well as saltwater intrusion into soils, not only threaten plant and wildlife, but can be linked to rising rates of hypertension, preeclampsia and eclampsia in pregnant women, and then, of course, affect the availability of fisheries and the water sources of wildlife, which has impacts for some of our tribal communities who still rely on traditional kind of fishing and hunting in some of these areas for their nutrition. So shifting gears a little bit from the impacts, and we could go back through each of those health impacts and climate impacts and talk about how and where, a little more in depth, where equity shows up. But just taking it kind of wholesale, we know that our health overall is dependent on our social, environmental, and behavioral context more so than our access to healthcare or our genetics. And as we see, both historical and ongoing injustice that has resulted in differential living conditions and socioeconomic status for many groups across the country, we see the way that that is interacting with climate change to create what's known as the climate gap. So we're just going to talk about that a little further as we go forward. So when we think about the living conditions, there are many that come to mind in terms of physical and place-based conditions that contribute or detract from people's health, whether you live in an area that is rich in farmers markets versus fast food outlets, if you have a lot of access to green space and walking and biking for your transit opportunities, or whether you're more dependent on polluting freeways and sitting in your car for hours and hours, not just for work, but for access to basic services. Whether you're situated near polluting sources like refineries and other energy production sites, but then also unseen kind of less physical conditions. So we think about just one, socioeconomic status and the type of work that's available for folks, whether it be sort of contingent and unstable with poor benefits, or more protected, safer work. We also think about access to, access to opportunity. So areas where a prior criminal history will prevent you from access to housing or to job opportunities and a chance to kind of re-enter society, voting participation, social cohesion. All of those things have outcomes that either detract from or promote health among individuals and communities at differential rates. And when we think about what does this have to do with climate change, it turns out that in the literature, these are the same things that either make an individual in a community either more vulnerable or more resilient to climate change. So, for example, if we have strong public infrastructure in terms of our housing and our transportation, we see communities that are able to withstand some of these climate impacts, or in some cases, evacuate. We know from Hurricane Katrina that those communities and individuals that were sort of left behind were the ones that didn't have access to personal transportation and lived in areas where there was poor transit options. We also see working conditions playing a big role. So again, in California, our farm worker communities and other outdoor workers have higher rates of exposure to extreme heat and air quality impacts. Again, first responders with wildfires and storms are at higher risk. So all of these things kind of create the conditions for health, but also for climate and health vulnerability. And the good news on that is that we have an opportunity to intervene on both climate and health at the same time through co-benefit solutions, which I'll discuss in a minute. I do want to just point to this slide, which is part of a much larger, very complex framework that you can spend lots of time on and with on our website, that sort of really dives deeply into this relationship between living conditions, health inequities and impacts, climate change health impacts and inequities, and then also other environmental impacts. And just as one example, if we take communities that in rural areas that experienced some of the greatest impacts from the drought, they not only had a reduction in their safe water quality and quantity, as ground level water stores were depleted, they had higher rates of exposure to contaminated water connected to previous environmental degradation through use of pesticides and herbicides in the Central Valley communities, where they were. So they're the one climate impact combined with other environmental degradation combined to really increase their risk inequitably compared to other communities. And this slide is just kind of showing an illustration of what that looks like. Of course, our low-income communities and communities of color, because of the interaction between place, race, and poverty in America, are at higher risk. But also there are other developmental risks. Again, the elderly, the very young, just by virtue of where they are in their physiology and development, are also at higher risk. So the slide is just illustrating, again, and the climate gap is actually the name of a report put out by researchers at UC Berkeley and University of Southern California, kind of looking at these impacts a little more closely. So that's another good resource to check out. So as I mentioned, this is makes for very complex negative impacts, but also provides us with a really unique opportunity to make our communities healthier and not just survive climate change impacts, but possibly even close our health gap, create more equitable, more healthy communities in the process. So we focus on 4 main areas of kind of climate action that have health co-benefits. And we don't think of one as preceding the other, but just to note that, you know, depending on how you look at it, you can take action for your community, you know, to create a more healthy community that will create a more healthy climate, or vice versa. So thinking about active transportation and transit, again, our transportation system and our land use policies that have created our transportation reliance around cars have resulted in lower levels of physical activity, contributing to more sedentary lifestyles and behaviors. And so getting people into more active transportation is a great way to just integrate physical activity into our daily lives. So thinking about walking and biking, which even if you increase transit systems and create those opportunities, it's a pathway to more active transportation. And we see benefits for heart disease, obesity, and some cancers, as well as mental health, excuse me, mental health benefits and social cohesion. Obviously, shifting our energy systems to cleaner energy would reduce a lot of exposures. Again, not only air pollutants, but other pollutants, for example, mercury from coal-fired power plants is a very potent neurotoxin. There's a number of chemicals involved in the life cycle, especially of natural gas and fracking, that are very detrimental to health. And so having huge outcomes for respiratory disease, cardiovascular disease, and also adverse birth outcomes is a huge benefit, as well as, of course, reducing those greenhouse gas emissions. There is a ton of work that we can engage in around sustainable agriculture. So creating more opportunities both for things like for local food access, like farmers markets and community gardens, but then also creating pathways for people to be able to access those. So, you know, allowing WIC or SNAP benefits to be accepted at those vendors. That can also make our food system more secure in the event of disasters, extreme weather events where, infrastructure might be disrupted and the ability to get food and water into a community is compromised. But also a more plant-based, local, organic diet can have benefits for our rates of heart disease and obesity, the exposure of antibiotics, many of which come through our meat and food systems, and then also pesticide exposure, while also, again, reducing some of those greenhouse gas emissions, again, meat related being methane from livestock production, and then also the production of pesticides and herbicides for use in agriculture is very energy intensive. And then lastly, urban greening, which I actually like to refer to as more green infrastructure, because it's definitely a necessity in many of our rural communities as well. And it has a lot of benefits, not only for heat reduction, but also flood risk and air pollution, and creates opportunities for more physical activity and carbon capture. So urban greening, a lot of folks think of mainly as tree planting, but it also includes things like just more park space, using permeable pavements for more water capture, bioswales, low allergenicity trees and plants in an area. So there are a ton of solutions in this area that can help reduce our heat and flood risks, help clean our air, and then again, give us more opportunities for health promoting behaviors. So I mentioned earlier some of the ways we know that physicians and other health professionals are seeing the impacts of climate change among their populations. And there have been by now a number of surveys done by the George Mason University Center for Climate Change Communication that have asked various, primarily physician groups, about what they are seeing. And as you can see, the vast majority do believe that climate change is relevant to their patient care. They say their populations are already being affected by climate change. And then you can see some of the ways they are seeing that show up, the top three being, extreme weather and wildfires. Chronic disease due to air pollution is a big one. And then again, that allergy, those allergy symptoms. So it is something that health professionals are seeing and believe is important to take action on, but it's also something that they feel, we know from these same surveys, they feel somewhat constrained to do, either by time or opportunity or lack of knowledge of resources, and kind of what's the next step that they can take with their patients and their communities. And that's kind of where we come in. We have come in with our Climate Champions project, and projects like your fellowship are so great, is trying to support the health provider voice, because we know it is so critical in terms of both individual patient action and larger policy implications. The health frame is a more powerful frame for taking climate action. We've all probably seen those doom and gloom sort of scare tactic reports, which have an impact in getting people's attention, but don't actually motivate action. Folks need to see solutions and feel empowered to take action on climate change in order to actually, do it. And health workers, as trusted and credible messengers, are important voices to bring those resources and bring those messages to communities. Health workers, whether they be providers, clinicians, public health folks, often are already connected to communities, and particularly vulnerable communities. So those opportunities already exist to capitalize on those relationships and bring solutions. And the most important piece is that this be done in partnership with communities, that the health voice be seen as kind of an expert supporter of community action and solutions, and understanding kind of what's at stake for many communities in relationship to climate change. So this slide just shows a number of ways that we have focused on, and I have some examples on the next slide, to have our health providers be involved. We initially began our Climate Champions program focused on physicians, and particularly physicians either from or serving low-income communities and communities of color, and kind of working across this spectrum of whether it be personal action to reduce your carbon footprint, integrating climate change into your clinical operations, both your organizational sort of green hospital, continuing medical education or resolutions, as well as your actual patient care, or doing more kind of beyond clinical and patient settings into communities, engaging with media, or getting involved in policy. In the last half or so of the project, we have shifted to engaging health providers more broadly and looking specifically at what can be done in terms of community and policy engagement. So that's been very exciting. And on the next slide, I have a few examples of what action has looked like for our champions across the spectrum. So we have a couple of op-eds and articles that were placed in smaller kind of ethnic community newspapers on unhealthy air, the impacts of the kidney disease that I mentioned. The picture of the television set was actually an interview that was done on Hmong TV in California on that same topic. And then we've also had folks give testimony for bills related to reducing climate pollutants. Some of our medical societies have passed resolutions just taking a stance and committing to further action. We had a public health professional give kind of informative testimony at a public meeting on the regional transportation plan to really encourage the council members to make more investments in active transportation as a way of improving health and reducing greenhouse gas emissions in the area. So those are just a couple of examples of ways folks have taken action, among our champions. So I think that is it for me. I'm happy to take questions. I had some questions from last year that I had put up on a couple of slides, just as in case folks had similar questions, particularly one that came up was around reproductive health, more on the climate science, things like that, that we can also chat further on if folks are interested. But otherwise, I think I'll hand it back to Lauren and take any questions you all have.
Thank you, Catherine. I really appreciate it. That was a great talk. Is there any questions from anyone in the audience? I think we're doing it through the chat.
And I know I have a tendency to speak very quickly, so also if anything needs revisiting, I'm happy to go back.
Well, I had one question for you while people are typing in their questions. You talked about climate change and kidney health. That was new to me. Can you talk about that more, suggest some resources for learning about that?
Sure, I may have to go back and get back to you in terms of resources, but in terms of for those who already have underlying kidney disease, the main risk factors related to rising heat and dehydration can affect them. And then in terms of so that's a big risk factor and something to look out for those folks. And then in terms of the populations where we're seeing this emerge, there's still a lot without any previous risk factors. There's still a lot that folks are trying to understand in terms of, prevention. One thing I wanted to mention about kind of, because this has been studied in worker communities and we need to think about equity solutions, this is connected, but is that, we have in California some pretty good regulations and programs around preventing heat stress and heat and dehydration that can either lead to or result in kidney failure. So we do a pretty good job of educating workers and employers about their rights and responsibilities related to rest and shade and water and all that. But we have structures that are in conflict with those efforts. So because our farm workers are paid based on how much they pick, their incentive to actually stop and take a rest and have some water and sit in the shade is lowered because they're already making near poverty or poverty level wages. That their incentive is to continue to work and to work harder so that they can pick more and bring in a higher wage for the day. So we really, when we're thinking about solutions, we need to be thinking not just about the proximate causes, hydration and cooling and that sort of thing, medication management, but also the longer term underlying structural causes. So I can definitely pass on the research looking at that emerging heat stress nephropathy, as they've termed it, as well as some other resources in terms of renal disease and climate change.
We've gotten quite a few questions in from the audience. First, we'll start with, what are some good resources to promote / amplify solutions to motivate action?
Definitely,
there's kind of the key question there.
Yeah, there are so
that
many.
A lot of people are struggling with. Yeah.
Yeah, there are so many, really depending on what you want to focus on. So I will send on a couple of links, but just to mention briefly, so we have, and I can share my screen to show some of them because I pulled some of them up, but in the area of communications, I mentioned George Mason University, as well as the Yale Communications Program. They have a lot of resources to just either think about, oh, how do I communicate this to inspire action? We have on our website a series of posters that we created for clinics to put up in their waiting rooms.
Sorry, Catherine, did you want to share your screen? Just making sure that
I can to show some of these if you like. Otherwise, I can just pass them on.
Oh, it's fine. Okay, you can just pass them on. It's fine. I just want to make sure it wasn't messing up. Okay, go ahead.
Yeah, so we have posters that can also be turned into handouts that you can just give to your patients. There are also, there's a lot out in terms of, if you even just Google like climate change and health posters, it seems like a lot of folks are creating a lot of different tools in the field of communications to talk about this. Here in Minnesota, I say here in Minnesota and here in California because I work for the center, but I'm actually located in Minnesota. Here in Minnesota, there's an organization called Climate Generation that does a ton around climate change communications work. In terms of, say, you want to take action to sort of green your organization, there's, of course, Healthcare Without Harm. They have a ton of resources. They're sort of the leader in green healthcare. There's also mygreendoctor.org, which is another wonderful resource. At the policy level, we at the U.S. Climate and Health Alliance are doing a state policy initiative that focuses on which policies at the state level, taking into account the federal gridlock on this issue, are the most promising and what are some resources for people to be able to promote those in terms of, from a health standpoint, how can health professionals get involved in those? So we have a number of fact sheets on policies related to energy efficiency, active transportation, and then we're coming out with agriculture and green infrastructure resources as well. And then in general, the U.S. Climate and Health Alliance, which we operate, we do have a resource library that is full of all sorts of different resources, from research to actions that folks have taken. And so there are a number of places. There's a relatively new organization also called the Medical Society Consortium on Climate Change. And that is an effort that I believe is also being operated out of the Center for Climate Change Communication at George Mason, but it's really all of the major medical societies signing on and taking action on climate change. And so they just had a big convening in Washington, D.C. They have educational resources as well. So I can pass a lot of these on, but it does depend a little bit on where you're looking to take action. And then our our health professionals guide, currently only released as the physician's guide, has a ton of links in it. We tried to make it very user-friendly in terms of sort of light on didactic content and heavy on resource links for people. And we have the entire last section is just focused on those 4 areas of solutions that I mentioned and how people can do more. You know, how do you get involved with starting a Safe Routes to School campaign in your state if you don't already have one, to promote more active transportation for youth, et cetera, things like that. Yeah, it has a lot in there, so I can definitely pass on a lot of those resources. If people have specific ones right now that they're interested about, we can try to brainstorm some of those as well.
Thanks. Yeah, I think people would appreciate a link to those posters. We have a question, and this might be a little bit too specific, but do you know if the rates for kidney injury has increased in the city of Flint since the Flint water crisis?
That is a really good question. And I don't,
studying that right now.
Yeah, I unfortunately don't know. And there would be kind of 2 questions. I mean, that, you know, of course, obviously the water issue with the lead, but then also thinking about, you know, has that been compounded by other impacts related to climate change that I'm just not familiar with? So that would make an excellent research question if it's not already being studied, but I can certainly, I do have some colleagues working with other folks around water access in Flint that I can reach out to and ask about that. I'll make a note.
This probably will be an easy question for you. Can you discuss a bit about the Climate Change Champions program and what you do?
Sure. So it has actually officially ended in terms of our funding period, but we're continuing to engage the champions. And we, again, started out with a statewide focus. So it's California focused, and was initially focused only on physicians, which is something we had worked to try to broaden from the outset. But based on some of the research and just kind of goals of the funder, we started with physicians, and we began with the creation of the curriculum as well as trainings delivered via webinar like this, but also some in-person training, and a lot of recruitment through the California Medical Association Foundation. So that's they operate a project, it's called NEPO, the Network of Ethnic Physician Organizations. So that is a network of all the various physician organizations in California that are ethnic specific. And we worked with them to sort of spread the word about the program, hosted a number of trainings, and then followed up with champions individually or in groups in terms of their interest areas. So we had one physician who was a pediatrician, particularly interested in heat stress in newborns. And she wrote an article for one of the local area parenting magazines about that and giving instructions. We had one physician do a series of interviews on Spanish-speaking radio about climate change and health, based on what we knew to be priority community topics in that area. So it was a lot of the activities that champions chose were kind of more like media advocacy and spreading the word, but we also had a number of them initiate resolutions in their health societies to just make climate change a priority. So overall, we trained about 150 physicians in that kind of first round. And we did find that the level of support needed was probably greater than we were able to provide to really sustain the project. And so in future rounds, we would think about how to help increase that support and make it more sustainable for the champions. And then in this kind of the second half of the project, we chose to, this was kind of post-election and thinking, re-strategizing around a lot of our efforts, we chose to focus on areas of the state that, even though it's California, are somewhat more difficult to discuss climate change in, especially in the Central Valley. There is a lot of oil and gas production and industry in that area. So even though those folks are seeing impacts in a big way in terms of the drought and on agriculture, et cetera, there's also a reluctance to talk about it, or kind of a lot of barriers to taking action. So we chose 4 areas geographically of California to go and conduct kind of day-long intensive on-site trainings for health professionals of any kind. So we had students, we had practicing individuals, public health, nursing, physician, respiratory health, kind of you name it, school nurses, et cetera. And we went through a day-long sort of curriculum that focused on impacts and solutions, engaging with the media, engaging around policy, green healthcare solutions, tried to just offer, we got kind of like impacts and broad solutions pretty, we covered that very briefly. And then based on kind of the local issues in the area, we tried to kind of get people on a path to action right then and there. So it was very tailored to the local context. And we trained about almost another 200 in that effort as well. So, and that we found to be somewhat more successful in terms of sort of solidifying people around taking action, and have continued in terms of our follow-up, have had more follow-up with that cohort than the initial sort of physician cohort. So we have so one of the things we've continued to sort of activate this group around is California's 100% renewable clean energy bill. We did put a little more emphasis on community action and policy in this second round as well. So trying to really think about where can the health professional voice be leveraged for broadest impact. We engaged in a couple of like Twitter storms around different issues on policy. So just a couple, we try to be creative in the opportunities. There have been some activities looking at fracking in the state that we're working towards organizing and activating folks around. So a lot of it is just being aware of opportunities. One of our champions went and attended a policymaker visit to just, join one of our colleagues to educate one of the legislators at their district office on some of these issues and the clean energy bill and that sort of thing. So getting them involved and comfortable in some of the policy process has been a focus of the second half of the project.
We have another question. Can you share any examples of community academic partnerships that focus on urban greening, healthy homes, heat preparedness, and energy poverty?
So there are a couple in Michigan. I don't have any, but I can look into that. In Minnesota, there has been a partnership. I'm not sure if you mentioned like greening or urban greening in general. There was a partnership between the University of Minnesota School of Nursing and one of the clinics to kind of green their clinic. They did some things around energy efficiency, waste reduction, patient education. So it's kind of a suite of things. A lot of times these are not, I should just mention that there's sort of a lot of these efforts we have found are usually sort of instigated by a single champion or, someone who's really passionate about it, and whether they then turn into sort of broader institutional partnerships is more variable. But so that's one that I could send some information on. Also in Fresno, I believe there are two kind of nurse partnership healthy home activities that were done, and there's the Fresno Cool and Healthy Homes initiative, which was done between Fresno State Nursing and the like public health visiting nurses in Fresno to do home assessments for cool and healthy homes and make referrals for weatherization and things like that. I'm trying to think of some others that have come up. I would have to see exactly what they're doing in terms of community partnerships, but Chico State in Northern California has just done a tremendous amount all around, both internally and in the community, to promote sustainability. So I could look back at some of the materials and contacts I have from them, but yeah, definitely the home assessments are a big area, and then also in general, we have found that nursing schools and nursing programs on the academic side tend to be another area where there's a lot of opportunity to partner around things like that. So I can send a couple of those resources forward.
Looks like our last question is about the reproductive health question being asked in the past.
Sure.
Could you please speak more on this and the effects of climate change on reproductive health?
Yeah, definitely. So a couple that we, and this is discussed a little more in detail too in the national assessment that came out in 2016. But, we look at some of the impacts, again, by exposure and developmental stage. So with extreme heat and air pollution, we see links to premature and low birth weight babies, as well as infectious disease risks also being linked to premature, low birth weight, and infant mortality following, extreme storms and infectious disease related to that. I mentioned Zika, and of course, again, we know that Zika was not caused by climate change, but we see ways that are being studied in terms of the exacerbation of the disease linked to climate change. So, for example, in Brazil, the drought was, a contributing factor to people sort of collecting standing, water, and then all these standing water sources that are being considered as a potential contributor to the proliferation of the disease in Brazil, as that kind of gave rise to more breeding grounds. We also, and then we also think about just the way the vector habitat is being spread along with other mosquito-borne illnesses. So that's another example where, again, it might not be directly arising from, but is definitely being exacerbated and allowed for further spread from climate change. Then we also do think of the relationship to climate change drivers. So again, exposure to mercury in relationship to coal-fired power plants and air pollution and adverse reproductive outcomes for children. We have a whole brief on pregnant women in the physician's guide that we talk about a lot of this in. So those are some of the main ones, though, especially heat, air pollution, and infectious disease risks. And then definitely mental health impacts and stress following extreme weather events have been related to preterm labor or preterm birth among women. So I think there are some examples for all of these from storms in the late 90s in North Dakota, as well as in Hurricane Katrina, that illustrate some of these impacts.
Well, that's the end of the questions. Thank you so much for going through all of that. I know myself and the participants really appreciate your time. So thank you again, Catherine, for taking time out of your day to talk with us. The next thing that we have to talk about is we do have an evaluation link. Our webinar evaluation is required for all current Health Leader Fellows. However, we strongly encourage all participants to complete the survey as well. Your feedback is valuable in helping us plan in future meetings. So this survey link will also be sent with the presentation and the slides. And our next training is a webinar about advocacy training, and we'll be joined by Ecology Center's Legislative and Policy Director, Alexis Blitzman. We'll be discussing advocacy, lobbying, and best practices for meeting with legislators. This will be in preparation to our Lansing Day, which is in May. You can check out the registration link, which will also be sent to you after this webinar, and register for that training as well. So with that, I'd like to thank you again, Catherine, for your time. Really appreciate it.
Thank you. I'll definitely be following up with a host of resources.
Great. All right. Well, everyone have a great night.
Thank you. Bye-bye.
Bye-bye.